Hey everybody, my name is Eric Vranish. I'm a physical therapist and I love running and I enjoy serving the running community. And tonight I'm going to talk about another thing about medial knee pain and talk about the MCL and why it could be your pain point, how to assess it, and how to maybe treat it. So anyway, let's go ahead and dive in. So your MCL on inside of your knee, right? So let's go ahead and unzip my little doodad here. So your MCL is, let's do that right there. Yeah, so we can do this, right? Yeah, so your MCL is right, you can feel a thickening right between your joint line. If you put your ankle over your opposite knee, you have this little kind of a flare, and it's where your tibial plateau kind of flares out just a little bit. Just follow that, and there's a thickening on most of us that you can kind of feel. And it kind of blends in with this thing called the joint capsule. But anyway, it's right here. You can kind of get this thickening of it. There's a lot of tests that physicians go through to try to figure out if it's an MCL as far as a pain point. But what you can do with your foot, sorry about that weirdness there. But if you take your foot and you push down on it and you kind of rotate your foot a little bit, that really stresses the MCL right there. And a lot of times, and you can really just do this on your own. So what I'm doing is, hey Carrie Ann, thanks for hopping on. What I'm really doing is just kind of turning my foot, not making it painful in my ankle, but turning it so that my tibia, my lower leg, is turning out and my foot's pointed down, and you can kind of stress out the area just a little bit, and you feel your MCL kind of pop into your fingers just a little bit. And even if you can't feel it, if you do that, you'll probably feel a thickening right here, just kind of popping your fingers. It's probably your MCL. And what ends up happening with some of us when we run, it depends on a couple of things, right? So if we run and our feet are turned out just a little bit, we tend to progress over our arch. And so when we're jogging, even or walking, I mean, most of the time it's really not that big of a deal, but after tens of thousands of cycles of running like this, and maybe older shoes, it ends up being a bigger deal. And so when you progress kind of with your feet turned out just a little bit, you progress over the inside of your arch a little bit more. Instead of going right over the front edge of your big toe, your big second maybe toe, when you're walking, you kind of go on, you kind of end up progressing over the arch a little bit when your feet are turned out. Let me kind of just give you an idea of what I mean here. So when your foot is kind of just, when it's turned out, this is excessive, and I get that, just to kind of prove the point. And if you go over this way, then you're going over your arch a little bit. Your foot's kind of collapsing a little bit more. What ends up happening is that you end up rotating your lower leg a little bit more underneath your long bone here. And so you end up putting stress a little bit, not much all on its own, but after tens of thousands of cycles, it ends up being kind of a big deal. And so that's one reason why you might have knee pain, medial knee pain on the inside, if it's your MCL. And we kind of went through how to maybe self-assess that a little bit while you're maybe getting a physician's appointment, or PT or chiro or whoever else you want to go look at. want to look at you. But yeah, so when your foot's turned out, you end up progressing over your arch more. When you progress over your arch more, your foot's slightly more unstable, and so you require more. Your arch tends to be a little bit more, a little bit too forgiving, and so it'll tend to collapse in. And when it collapses in, or towards your other knee, it ends up putting a little more stress on your MCL. So that's one reason why you can have medial knee pain be from your MCL. And that can be from a person that doesn't have, a really high arch, or doesn't have, maybe has a normal foot mechanics, but just their foot is just turned out. And they might be wearing older shoes. Their shoes might be a little bit more, maybe too neutral, meaning just too cushiony, just really soft. And so it allows for a little bit more collapsing a little bit more, which if their feet were kind of directed more straight ahead, it wouldn't be that big of a deal. And then there's the person that's the overpronator, which is my foot. And so it ends up happening even more, even if your foot is slightly more lined up straight ahead, your foot just simply collapses a little bit more. And so what ends up happening is that even if your foot, a little bit more down here, sorry about that. So even if your foot just kind of is fairly straight ahead, and if your foot is easily collapsing, then your knee just kind of fades in. Now it's maybe not that extensive when you're running or when you're walking, but even just a little bit too much for the MCL, but after tens of thousands of strides, it ends up being a big deal. And so you end up having this chronic, very light stretch of the MCL, but over time, it just kind of this thing that just kind of slowly creeps up on you. And it ends up being an issue. And so with a couple of other structures. But anyway, that's the MCL, and that's how to maybe self-assess it, and why it might be your pain point if you put those two things together. And then what I'll do, just to kind of see if it's helpful, I'm not a I don't advertise for rock tape, but I guess I am. It's just an easy kind of a way to figure out if your arch can be helpful. And so your knee, I've said this in the past, your knee is kind of caught between sometimes a pretty mobile foot and a ball and socket joint for your hip. And you have very long levers that are trying to be controlled by your hip and your foot and kind of direct your knee. And if that's not happening on both sides of the knee, then your knee kind of takes the hit because it's only told where to go, mostly really told where to go from what your foot's allowing to happen and your hip is allowing to happen. So anyway, so what I'll generally do to see if it could be an MCL, among some other things, but this is kind of a one thing that kind of helps with the pain point that we're talking about. Let me put you back there just a little bit. All right, so here we go. Where are you? Anyway, so maybe the last, I use this stuff all the time, and I try not to advertise for rock tape. That's what it is. I mean, it can be TheraBand tape, it can be Kinesio tape, it can be some of the others. There's tons out there, but anyway, so about maybe an inch, 2 inches right there. And what I'll do is put it right on the inside of the arch there a little bit, the inside of the big toe. And what I'll do is I'll kind of pre-position the foot to point it down and out just a little bit. So kind of down and out, just to kind of create a really good arch there. And I'll stretch it out, maybe 75% of what the tape can allow for, and then tack it up there. And then I'll do a piece right over top of that. And I try to, the first layer, what I'll try to do is I'll go from the inside, kind of the big toe area, and kind of diagonally go around maybe the outside of the heel while the foot is kind of in this pretty good arch position. because that's kind of what you want to try to consider doing. And whether or not the person has the feet that are flared out with a normal arch or not, this is a good test too. So anyway, and another one, kind of like in the same area. And so it ends up happening, if you do this on your own, it could, I've done this a lot, and you can do it for a big bunion on the inside of your toe. You can do it for posterior tibial tendonitis. You can do it for sometimes Achilles tendonitis. You can do it for medial knee pain. You can do it for anterior knee pain. A lot of times the arch height and its sometimes excessive mobility ends up being a problem for a lot of pathologies up the leg, up the chain. It just ends up being a whatever reason one point gets picked on more than the rest of them is because it just happens to be the weak link for that particular person with their particular anatomy. That's all. So anyway, yeah, so there's my foot right there. And what ends up happening, I'll stand up over here again. And sometimes you guys just need to have your sock on right afterwards, because it'll just end up popping off right when you get up if you don't. But just for demonstration purposes here. So the arch is kind of a little bit more helped out. So it right now. So it ends up happening with a person that kind of flares out a little bit when they run. They're not going to be as easily able to flatten out that arch as they go over it. Now, if this is the person that has, you know, a fairly good arch, but toed out a lot when they run, this will help out. But what they just simply need to do, they need to start training with their foot a little bit more forward and straight ahead, or get some shoes that aren't so old. Sometimes they need to get a newer shoe, and most people need to start out with at least a stability shoe. You can always make a stability shoe a little bit more soft, and you can always make a stability shoe a little bit more lofted for someone that needs a little bit more help in the arch, unless they're your feet that are really fairly high and firm, and have massive calluses underneath the ball of their big toe, their outside fifth toe, and the ball of the big toe and the ball of the outside fifth toe and their heel. You have massive calluses there. Chances are you just need a neutral shoe. Something that's going to absorb shock, because your foot's just not doing a very good job at absorbing shock, and that's why you have all these calluses. But anyway, let's see, what else was I going to say? I think, and it's also helpful, obviously, for the foot that's kind of just ends up being a little bit more flat. And you try to progress over your foot, but your knee just kind of collapses over a very mobile foot. So if that tape job helps out in either case, chances are you need to get a little bit better. You need to get into new shoes. Your foot might be a little bit more mobile if you run with your feet more straight ahead. You need to get another shoe. You need to make sure it's at least a stability shoe. And you probably, unfortunately, need to do a little bit of cross training at that point too. But yeah, is there anything else I want to talk about for that? Yeah, just kind of a self-assessment, and how to kind of help analyze whether or not you have that problem, and how to, because the taping becomes like a self-assessment and a treatment. Because if it makes it go away a little bit, well, then you found something that's going to make it go away, and you might be able to run a little bit with it. But you're going to blow through that rock tape in a run or two. You need to start looking at some other shoes for your particular problem, or maybe your gait. If you tend to flare out a lot, you might need to train your foot in a little bit more. Sometimes what ends up happening is if you do that, well, then your knees start when they bend, they start going together, depending on your anatomy. And so sometimes it's just the best thing is to get another shoe. Maybe get a stability shoe, because most people do need to start there. Like I said, unless it's the person that has a fairly firm foot, it doesn't move much, and they have some pretty notable calluses underneath the ball, their big toe, their fifth toe, and their heel. And so, yeah, I just want to say hey to everybody on here. Carrie and Genevieve and Lamont, no way, man. Good to see you, bro. Hope you're doing well. Stanley, Reed, I've seen in the past. Good to see you again. Mike, Katrina, Linda, Norm, Steve, and Jeff. Good to see all you guys here. And if you guys got any questions, give me a holler. We just talked about MCL and how to self-assess, self-treat, and get back on the road running a little bit more effectively with some of the tools and tricks that I do in the clinic almost on a daily basis, depending on the pathology, depending on the problem. Let's see here. Yeah, so any questions, any comments about anything? If you're here live, that's fantastic. Let me know. If you're here on the replay, let me know. That'd be great. And I like to dialogue with you, see how you're doing. And I like to give out, fantastic content to runners because I know you guys like to hit the road. And sometimes you're looking in places that, for solving your pain points that may not be very effective. So I try to be effective for you guys. And a couple of days ago, I did a medial knee pain point problem that is from the saphenous nerve. That ends up being an issue for a lot of people that most people just don't think about, and most clinicians don't think about. I didn't think about until maybe 10, 15 years ago, that the nervous system ends up being pain points. They end up being pain issues most of the time. We just don't find them because we don't look for them. And so last week I did that. If you guys want to check that out, that'd be great. But yeah, any questions, comments about anything? If I don't see anything, then and I'll feel you guys are doing well. And feel free to DM me if you like about your pain points. Maybe we can dialogue and help you out somehow. So take care. God bless you guys. Have a great night. And we'll see you again. God bless.